Okay, so this is June. She is a CT and radiology tech here at Baylor Garland. Hello. So what certifications do you hold?
I am registered in both diagnostic and CT. I've been registered in diagnostic for 36 years, and CT for about 3.
Okay. So what made you choose CT? Like, what was it? What was it?
Well, the way the field is going now, that there's more job opportunities if you are what they call a multimodality tech. So you have more than one modality that you're registered in. Most freestanding ERs and hospitals also are going that way, to be where it's CT and DX becoming more like that's the norm.
Mm-hmm.
So I started doing CT back in '92. My husband was also an X-ray tech, and I started doing it, just helping him out, and kind of just stayed with it.
Okay. So what education was required, and where did you go to school for it?
When I started doing CT back in '92, there was no specific school for CT, and most training was on-the-job training. And so my training was just on the job. Now, to take the registry, when I took it, it was not required to have like a college course in it or a specific course. Mm-hmm. You could just challenge registry. So I took, I believe it's called MIC. It's a course from a college in Florida online. Okay. And it has like 8 little chapters that you do, and you send each one off. It has a test at the end of it, and you send it off and get it back. And I did that, and then there's a online, it's called CT Tutor, mm-hmm. and it's like taking tests repeatedly that are like the registry on the computer. Okay. And I did those 2 things, and that was pretty much it.
Okay. So what characteristics are important in CT?
CT can be challenging in the fact that some patients are claustrophobic, mm-hmm. and they freak out at you and start backpedaling out of the gantry. So you have to know how to kind of deal with that. Little quirks that might help, like putting a wash rag over their eyes for some reason, seems to help. Sometimes they want a family member to hold their hand. Children can be challenging because they look at it and they freak out. They think it's swallowing them or something. I don't know. So you have to figure out ways either to tie them down or try and keep them asleep. Lots of times they'll come in asleep in their parents' arms. If you put really warm blankets down, put them on the warm blanket, cover them up with warm blanket, they still feel the warmth and they think they're still in their parents' arms, and hopefully they can kind of like just keep them asleep. Mm-hmm. And that works. So you have to have patience, and you have to kind of think outside the box, kind of like with DX, but they got to be still longer over there.
Yeah. Okay. So what's your favorite thing about CT?
I like doing like angio chest, PE chest. I like doing the 3D reformations afterwards. It's a little bit more of a challenge than just doing a head or an abdomen, because it's pretty much like doing a chest x-ray. We do so many of those, so.
Okay.
I kind of like that.
And what do you think is the most difficult? Just in general.
Probably when we have to do like angio, head and neck, the reformations on that, because the way we do them here, it takes like 20 minutes to do all that.
Okay.
So then you get kind of backed up trying to get that done before the next patient.
Okay. What is your favorite procedure and why?
Favorite procedure? She's doing an interview.
Oh.
Favorite? Gosh. I don't know if I really have a favorite. I guess when I'm doing somebody that truly is sick and not just somebody that's saying, yeah, I've been hurting for like 5 years, or like when we do a stroke and they come in and you find that bleed and you know you're going to hopefully help that patient. You find something that's going on with that patient and you're able to make contact with the doctor and get that expedited.
Mm-hmm.
So when I'm actually helping somebody,
Right.
instead of just, you know, somebody coming in wanting something.
Right.
Don't really need it.
So what advice, if any, do you have for me moving forward in radiology?
One, definitely the way the field is going, I would definitely suggest getting 2 registries. The pay is better when you have a dual modality. The job opportunities are greater. You can go to a lot of these freestandings that are popping up. That's what they want, is multimodality, you know, CT and diagnostic. A lot of the hospitals are going that way because they find they can move that one person around between CT and DX if need be, or they can do both.
Yeah.
So I just think that would be something definitely that most people coming out now should look into.
Okay. Well, thank you very much. I appreciate you taking the time
Absolutely.
to do
No
that
problem.
with me. And that's it.